First of all, I just wanted to thank you for allowing us, inviting us to come and speak with your group. My name is Lisa Germann, and I am a physiotherapist. I work at Ontario Health at Home, and this is Cynthia King. She's an occupational therapist working with our team at Ontario Health at Home. And I just wanted to kind of explain a little bit, as Gareth said, it used to be called the CCAC, and then it became the LIN, and then we were Home and Community Care Support Services, and we are now Ontario Health at Home. So we are from that agency as home safety therapists, so we thought maybe we could have a little chat about some considerations of home safety and talk about our services. And I'll just let you kind of talk about our agenda, and then do you have the clicker? Oh, the clicker.
Commonly known as the clicker. Okay, so we just have an agenda just to kind of guide our discussion, but Lisa and I thought it would kind of be informal, so if you think of questions, please just raise your hand. We don't want you to lose a train of thought or something that's important. So we want to talk about the services provided through our agency, and we want to talk specifically about Lisa and myself, our role when it comes to a home safety assessment. So what is that? What things do we look for when we go out into the homes? Some of the common recommendations. Now, just to keep in mind, our recommendations are tailored specifically to our client, to their home environment, which we go into, but we can kind of just give some general guidance about some of the common things that we recommend when we go into people's homes. Now, community resources, we already just had a great presentation from Holly, and we often refer to community support services for our clients. So if we're the first person to go into the home, then we can connect people with Holly's organization or other organizations as well, and likewise, Holly's organization can connect back with us. So it's a very kind of symbiotic relationship that we work very closely together. And then we will have dedicated time for questions, but as I said, if you've got a burning question, feel free to ask us at any time.
Okay. So I just want to talk a little bit about the type of services we have. And there is a Connecting with Care handout that kind of discusses all of the services that we have. So we have a variety of services, and I just want to say, as Kathy you had mentioned earlier, anybody can make a referral to Ontario Health at Home, to home care, I'll just call it at this point. It can come from the hospital. If someone's being discharged from the hospital, we have care coordinators in the hospital that may set up and go, okay, this person needs maybe an OT for a home safety assessment, or a physio for some mobility and strengthening post-hospitalization, or other services which we'll get to. But it can come from the family physician, it could come from a specialist, but it could also be a neighbor that's concerned and they can call in on their behalf, obviously with client consent for that. But you can call on your own, and our intake will kind of go, what do you need, and look at eligibility of services and kind of direct you that way. So it's not something that has to be referred from a specialist or a doctor. So we have a variety of health services that will help people at home, in the community, in the school, and part and parcel we have nursing. So nursing will visit in home if that's someone that can't get out to one of our community clinics. And nursing will come in. The community clinics are kind of embedded throughout the region, and they are run through Ontario Health at Home. That might be wound care or things that you can actually get out to, IVs, those kind of treatments. And then we also have in-home for people that aren't as mobile or can't get out to the clinics. And then personal support services. So this would be, we contract out to agencies. So you may hear Paramed or Care Partners, different agencies. So we would contract out to those agencies that provide nursing services and personal support work. They really help with personal care, bathing, dressing activities, those kind of things, to help someone maintain their personal care. And then we have occupational therapy, we have physiotherapy, and sometimes people say, well, what's the difference? And we do overlap. We work on a home safety team. You would think physio, myself, kind of restoring, improving range of motion, strength, post-injury, post-surgery, you're deconditioned, having falls. We look at balance and home exercise programs. And yeah, your walking pattern, your mobility, your stair safety, like we'll get into all of that. But really just how someone is doing with their mobility at home and how we can help, and it could be through exercise, pain management strategies. Occupational therapists, they would look to as well at falls prevention, transfers, mobility, and how they manage their day-to-day tasks, as we would call them ADLs, activities of daily living, all those dressing and bathing and all of those activities, but also how they manage what we call instrumental activities of daily living, which we call IADLs, which is like kitchen safety, meals, how they're managing cleaning, laundry, and also looking at cooking and different things like that. You can talk about that. And so the other piece is there's also speech language, therapy, pathology, sometimes issues with swallowing, social work, and nutritional services as well. And we do have palliative end-of-life care support and placement services, for example, information about long-term care, alternate living settings, and so we have that kind of information, because to go to long-term care or to be, that's an eligibility and an assessment, and that does happen through care coordinators through Ontario Health at Home. And we have people that can answer those questions by calling in as well to our office. All right. Let Cynthia go.
So one of the very common referrals that we receive, Lisa and myself and the other therapists on our team, is to do what we refer to as a home safety assessment. And basically, if someone has had falls, is at risk of falls, has had a change in their medical condition, a referral will often come through if someone was in the hospital, maybe from the family doctor, or as Lisa mentioned, a client or family member. Just requesting someone come out to the home, have a look at how they're doing, and see if there's any suggestions that could be made to improve the safety. As we probably all know, falls are one of the leading causes of injury for older adults and often result in hospitalization. And if the injury is serious enough, it could be loss of independence or potentially loss of ability to live independently, and we don't want that to happen. So a lot of what we do is education about falls prevention. And sometimes it's very maybe simple or common sense things, and things that are easy to change. That if you put in a few small changes in your home environment, or more aware of things to look for, then you can make your life so much safer. So myself, I've been doing this 25 years. I've worked in the community my whole career and absolutely love it. I think it's just a privilege to be invited into someone's home and get to see how they live day to day, get to meet their family members and other people important in their life. And so as soon as I get a referral, I review the information, I call the client, or if they have a designated person that they want me to talk to, I speak with them, introduce myself, explain in general what I'm going to be doing. I'm going to come out to your home, I'm going to, ask you to show me around, ask you to demonstrate a few things, and then from there we'll have a discussion, see what your goals are, and hopefully come with some recommendations. So my home safety assessment starts when I pull up to where I'm going. So whether you live in a home, apartment, condo, sometimes we go into retirement homes or other seniors buildings. So I'm looking at, well, what's the layout of the building? Are there stairs to get into the building? Is there a ramp? Is it a covered area, or is it out in the open to the elements with snow and rain and all that good stuff? I look at parking. So would the person park right in front of their home? Is there other designated parking, underground parking? All those kind of things I'm kind of observing as I go to the home. Then when I finally get into the home, I'm looking everywhere. And it's not to be, some people are saying, oh, I haven't cleaned my home, I'm so sorry. That's not what I'm there for. I'm not there to be nosy, I'm not there to look through every nook and cranny. I'm here for safety. I'm here to see what things kind of jump out at me as potential concerns that maybe I can bring to your attention, or maybe you said, yeah, I kind of know that already. I kind of been meaning to do that, and maybe this is just the little bit of a nudge that you need. So this picture shows stairs. So we're often looking at stairs. So are you in a bungalow? Are you on one level? Are you in an apartment where there's an elevator? Are stairs not a concern, or are stairs a major concern? You've got multiple levels that you have to go up and down. What is the flooring like? Is there carpet on the stairs? Is it in good condition, or sometimes older carpet can start to buckle and fray, and that could pose a tripping hazard? Is there railings on the stairs? Is it in good condition? Is there railings on both sides? What are you carrying up and down the stairs? Are you doing that safely? All of those things we're looking at and talking about. Flooring, do you have clear pathways throughout your home? Or are there kind of things that you kind of have stuck along both sides that are just taking up space that maybe we could find other homes for? Is there cords? Maybe we all have technology and everything has cords and cables, but are they nicely tucked away and they're not crossing through a room or through a hallway that you could trip over? Our beloved pets, as much as we love them, Lisa and I can tell you so many stories of clients who tripped over the dog, or tripped over the leash, or tripped over the cat toy. And so just to be mindful that anything can pose a tripping hazard, and we just want to have top of mind some of these things that could impact us. We look at, so in the home safety assessment, I do ask can you show me around? Can you give me a bit of tour of your home so I can see where the bedrooms are located, the bathrooms, kitchen, all the areas of the home that you would need to access. So in the kitchen, we talk about are things you use most often within easy reach. You're not climbing up to grab something off the top shelf. And if you are climbing up, what are you climbing up on? Step stools, chairs, we've seen it all. So we ask those questions. Again, it's maybe you hadn't thought of, okay, well I do use that crock pot, I do use that. Why am I keeping it up on the highest shelf? Why don't I keep the things that I need? We have clients that use one bowl and one cup and they just keep it right there. That's all I need, and then I wash it, and then it's there for me to use. I'm not having to go to this cupboard to get this bowl and this cupboard to get this cup. Just make your life a little bit easier. We look at the bedroom. So how do you access the bathroom at night? Is there enough lighting? Is there clear pathways? We love our little night lights to guide the way. And then bathrooms. Oh my gosh, the amount of times we spend in people's bathrooms is like, sometimes we have a little party, oh you come in and your spouse come in, and let's just talk about everything to do with the bathroom. But it is one of the areas of the home where there's the most hazard, because we're talking about water, and we're talking about a bathtub or a shower, or accessing those things that we do every day. Even if you just do a bit of grooming, you're going into the bathroom, standing at the sink, whether you're doing your shaving, brushing your teeth. So we spend a lot of time, how are you accessing the bathroom? Do you use a tub? Do you get into the tub? Do you stand in the tub? Are you using a shower? How often do you get in? Do you have safety equipment? All of those kind of things. So once we've had a tour of the place, then we often will want to sit down and say, these are the things I've noticed along the way. What concerns have come up for you? And we kind of then work together to come up with a plan. and then Lisa will talk about some of the recommendations we would make.
Okay. Okay. So, the biggest thing for me is what's important to the person I'm seeing. Like, I have a lot of good ideas, I think, but they're like, I'm not doing it. But really, at the end of the day, I'm in their home, and they've let me in there, and like we said, we're privileged to do that, and they're showing me their personal space, right? And I'm really there to what's important to them, what would you like to know, I'll give you some recommendations that I think might be helpful, and they can choose to do what they want to do. And so it's based on their goals, and we just want to come up with strategies. And sometimes I'll lay it all out, and then I'll leave, and then I'll call them, and I'll be like, what do you want to work on? And then I go back and do those kind of things, right? And I have some visits to go and work on those goals. So it's not just overwhelming on day one. So some of the things, like environmental modifications, obviously, we do. I'm going to overlap with Cynthia a bit, but we look at like railings, we look at the lighting, stairwell lighting, lighting at night, how many times you getting up to go to the bathroom, but just even some stairwells are very, like down to the basement, they're darker. So, and then what's on the stairs, carpets, how steep they are, so there's a lot of factors there. Maybe a main floor setup for some people that come home from the hospital and they're like, everything's upstairs, but you know, they have a bedroom on the main level until we're able to safely get up those stairs and access that. Oh, there's so many things, but I was just thinking with the kitchen, like we just try, like we said, keep commonly used items here, the microwave easy to get to. If cooking on a stove is something that has been a concern, then you know, if you put a pot on and you get distracted and you're off getting the laundry or someone's called on the phone, even I now have like this little timer I set beside the stove. So if I leave for 5 minutes, I realize I left that pot going. Or we just do things that shut off, like I guess like toaster ovens and microwaves and things like that, so you're not worried about that. Accessible showers. It would be amazing if we could just have a walk-in accessible shower everywhere we go, but we try to work with what someone has and what they're willing to do to change it, but also there's also equipment things. So equipment, gonna talk about that, like there's lots of things. In the bathroom, do we need a raised toilet seat or toilet bars? And so we kind of measure, we watch how you function, and we come up with some recommendations and ideas. Bath seats, tub transfer benches, kind of watch how you get in and out, a dry run of the shower.
We threatened to turn the water on sometimes.
But you know, where do you, because some people have functional limitations with their joints, their range of motion, they're not able to step over the tub lip. So then we look at ideas about how can you bathe? Are you sponge bathing, or are you able to get into the shower, and how can we do that safely? So it could be a bench, and then we kind of talk about grab bars, and then is the structure of the wall okay to put grab bars in, and so is that safe and secure? So we have a variety of vendors locally in town that sell lots of home safety equipment, and that also sell grab bars. Some of them have installers, but you definitely would want to get somebody that is a contractor, an installer, to determine if your wall is safe to securely put a wall-mounted grab bar in. Dressing devices. Some people are like, how can I get my socks on myself? Or I'm having trouble. So we work on sock aid devices, reacher sticks, things like that. So yeah, there's lots of things. I have slip-on shoes that go right in. I don't have to bend down. We're good to go. And then falls prevention strategies, as Cynthia mentioned, like it's important your footwear that you're wearing. If you're wearing socks in the house, sometimes the non-slip socks with the little markings on the bottom is good, or you're wearing supportive shoes because that's good for your joints and you might have hard floors. So just understanding, and then cords, I keep looking at this one. Can't say I haven't fallen this year, but we, so cords, loose mats, we're not like the mat police, but some mats are kind of loose and you can slide, so if there is going to be a mat, it should be thin and have a non-slip rubber backing. And obviously that's a very important thing in the shower, what you step out on, and also what you're stepping in on. And so having surfaces like that.
Have you seen newer inventions come out? Because what I've seen is they're kind of the same old things. Have there been any new and great devices that have come out?
You mean the shower safety?
For any of it.
Oh yeah, I mean the vendors are coming up with, if you go to a vendor, they have lots of things that are new and exciting that they're trying to like. If someone still really wants to have their bath, but they can't get down in the tub, there's everything from electric bath lifts where you slide over and it takes you down, and you still have your bath, whatever's important to you. Yeah.
Good.
Yeah.
Old is still good.
What's that?
Old is still good.
Yeah, well,
Around the
yeah. We help people with walkers if someone wants to try a walker, and they can be like anything from the aluminum holding ones with just 2 fixed wheels depending on your mobility, or the rollator walkers, you know, with the seat, the basket, the handbrakes, like that. And if you're eligible, there is government funding, depending on eligibility, that helps. It's called the Assistive Devices Program, and it helps to pay for up to 75% towards a walker or a wheelchair, and there's eligibility about that. But I said be mindful, like things of pets, clear floors. It's funny because I say all this every day at work, and then my mom comes over and I'm like, clear the path, I don't want her to, you know, I'm like, why wasn't I living like that? Anyway, and then, yeah, just keeping, the other thing would be like medical alert. I like to talk about that a little bit. There are different alerts out there, and that's getting better too. Like some have them on their phones, like or watches, and they have them on their phones and fall detection devices. And we all think about Lifeline and different things, but sometimes we can come up with some strategies about that as well. And medication safety, we look at that as well, in terms of how are you managing your medications, how often do you take them, what's your strategy, and then we look at ideas about how are we, if we're missing medications, or how do we kind of sort that out. So we give strategies about that. I was talking about falls prevention, but we'll go down to exercise. As a physio, I like to give most people some general exercises depending on if I'm seeing them for an injury. Obviously I'm very specific, but I also think it's very important to just maintain your mobility the best way that you can. And it can like breathing exercises, seated exercises, keeping mobile, and just trying to really do it safely. So there's home programs our physios can provide, the OTs would provide some as well. And Holly was here talking about the SMART program. I do refer a lot of people to community support services or connections for their SMART programs, which can include one-on-one, where they have a set of exercises that the trained volunteers are able to do with them, and then they would come, if they're eligible, like twice a week for a few weeks until maybe they can get out to a community program. And these are covered, as Holly explained, and they're kind of all over locally in different centers, and they're good programs. And then there's just the indoor walking tracks throughout the region, which are good to get to. And there's the Y has great programs, and community centers have good programs, and it's just good to get out and mobile, but also be social. So I think that's all I'll say for now. I can just keep talking.
Yeah, and I think Holly's presentation was a great lead-in, because we often refer to community support services for our clients, but you can call. I think the bottom line is you can reach out to these agencies yourself. You don't need to wait for a doctor to refer you. You don't need to wait for something to happen in order for you to access them. You can be proactive, and even just to call to say what's available in my area, because as Holly mentioned, it depends on geography, some of these programs. So she had mentioned the Meals on Wheels. There's so many meal delivery options now. I don't know if it's because of the pandemic that a lot of companies got into this business of preparing meals, and either you can pick them up or they deliver. Heart to Home meals is something that a lot of our clients see. I think they're advertised a lot on TV. So I just encourage people just to try different ones, see if it works for you, see if you like them. You don't have to get something every day. Some of our clients maybe get Meals on Wheels twice a week, maybe get Heart to Home delivering a few meals once a week, and then they have a bit of variety. Transportation services, so Holly mentioned through their organization they have volunteer drivers, and there's a cost for that service. There's also some accessible transit services. You might have seen the Mobility Plus bus goes around. In the townships, Kiwanis Transit is another one. Now those are, you have to fill out an application form and you have to meet some eligibility criteria, but those are certainly good services for people that need them. And again, so Holly mentioned all of the other, in-home maintenance, out-home maintenance, grocery delivery, all of those services you can access for a fee. Another one we like to talk about is day programs. So I'm all about how is your physical health, how's your emotional health, how's your socialization. And especially with the pandemic, we found that so many people were isolated, maybe programs they used to get out to weren't happening anymore, and so we often talk about programs in their areas. There's so much at all of the local community centers. I picked up a brochure for downtown Kitchener. My gosh, there's every activity you could ever want. So I just encourage people just to get out. That social component is so important, and that physical exercise. We talk about that all the time. How much exercise are you doing now? How could you do a little bit more? What could you add to your day? A little, now the weather's nice, getting out to do a little bit of walking safely, or like Lisa mentioned, some of the walking tracks, mall walking, anything like that to get a bit more exercise. And I guess what we would want to say is don't hesitate to reach out. We've seen, over the years, I've seen clients who've been struggling for years and said, I didn't know what to do, I didn't know who to call. Maybe you don't know, should I call Holly's agency, should I call Ontario Health at Home, but call somebody. And if you call us, our intake team goes through a screening with you, gathers more information, and if it's not us that could help, they will give you information about where you could go. But just, we hate to think that people are, struggling, and they're waiting for their doctor maybe to refer them or tell them what to do. Just reach out, and we're here, we're ready, willing, and able to help. Now there is eligibility criteria, but it doesn't hurt to call in to speak to someone at our office, and they'll guide you from there. So thank you. We're happy to take any questions that you have.
Now we exercise. Ready? No.
Yes.
Do you have any suggestions for a couple where there's Alzheimer's involved? What program would they call, and what sort of thing would you expect? Because I know recently we know somebody that reached out and the person came in for an assessment and said, so what can I do for you? So I'm just wondering, and it's not in this area, but I was just wondering.
So we didn't mention, but the Alzheimer's Society has wonderful resources as well. And so if that's your first point of contact, they have social workers, they have caregiver resources, they sometimes have respite programs, activity, lots of resources. And they sometimes connect back with us for the professional services. If they're like, well, you should be assessed for PSW because you're struggling with personal care, or maybe you should have a home safety assessment. But the Alzheimer's Society, again, you can self-refer, and I often get referrals from there. Or a client's gone to a geriatrician or a memory clinic and got a referral for Alzheimer's, and then they're connected. So again, it doesn't matter at what point you enter the system. Encourage, if it's someone you know or a neighbor, encourage them to reach out to someone to start the connection and the support, but All Summer Starting is a wonderful agency. I've had lots of clients
I
benefit
think
from their
it's
support.
denial
Yeah.
and not wanting to admit that that person has problems.
Right.
And then it's hard for the wife,
Yeah.
because, you know.
Yeah, and we've had clients, as Lisa said, so we go in and do our assessment and make recommendations, and we sometimes have clients say, thanks for the info, but I'm not ready yet, or I don't need anything yet, but we always invite them to connect back with us, keep our number, because there may be a point down the road, we've had clients a month later,
Oh, yeah.
6 months later, a year later, say, okay, now I'm ready, or now at least I know what's available, should I need it. So it might not be at that point in time, you're not ready to, okay, let's put in the bars, and let's do this, and let's do that, but it's like, okay, I have the information I need, and I know what I can do and where to go in the future.
And we do have, part of our assessment is a little bit about how are you managing with your memory, your cognition, do you have any concerns or safety concerns, and we kind of try to address that, like we're not diagnosing anything, that's something that goes through the physician, but, like, those are things for safety, it's really important. Yeah, yeah.
It's been most interesting this morning. As a caregiver, not at the moment, but in the past, it's wonderful to know that there are all of these community resources. But the problem that I ran into was the lack of professional personal care workers. And I am noticing it where I live right now. There is a woman who has services, but she gets them at really inconvenient times, like getting ready for bed at 4 o'clock in the afternoon, or there is a necessity, I think, not only to have services, but to have the people trained to be able to provide those services. And I think we need, as aging people, more advocacy for the training. I applaud you for the work you're doing, but I think that if you are in your home as a caregiver and you have a loved one that needs personal care, it's not that easy.
Well, just I'm thinking it's hard.
Can you use the mic?
Yeah. Well, I mean, it's with PSW or personal support worker, yeah, depending how often someone needs care and the availability of PSW through the agencies and the timing. And it's hard when it's someone maybe different every day. But the hope is that sometimes that you get someone a couple times a week, that eventually it could be the same one or someone you're comfortable with. Because I know it's different people coming in. And then there are people there are private pay personal support worker agencies, right? That there is that option as well. But, and so we have lists of that where someone might get a personal support worker privately, not through, contracted through Ontario Health at Home, that can help with different things like bathing, but also laundry, shopping, some extra cleaning, so that they work with that privately. But I hear what you're saying. I understand that. And another thing I was thinking about is, what about the caregivers and the caregiver support, like when you're saying about, and there are agencies out there like Ontario Caregiver Organization, OCO, which is fairly new, that started up in just before the pandemic in 2019. And so I sometimes go on and they have a lot of resources there as a caregiver. This is different than what we were saying, but that is something I wanted to mention, because when you go into someone's home, it's the whole picture. It's not just the person I'm seeing, it's like, how's everybody doing and how is that going? So having an understanding of how the caregiver's doing in those circumstances is really, we really look at that too. Yeah. But I understand it, yeah.
To tag on to that, it's, I know people, because they keep getting different PSWs coming in, we have to remember, this is our dignity. I mean, you're showing strangers what strangers should never see. So it's all about dignity.
It is.
So, yes, yeah.
Yeah, it is about dignity and privacy and what you're comfortable with, and also it's how can they support in a way that supports that, supervision or help, but then let me do what I need to do, right? It's not always do for, it's do with, right? How can we as support you, what are you comfortable
But
with?
we always have to keep the dignity first and foremost.
You are very right,
Yeah.
most definitely, as soon as people walk into their home,
Yeah.
for sure. Yeah,
Excuse me.
yeah.
So as someone who was a PSW, I can address some of these things
Great.
because it's very hard to do that job because everybody wants to get up and get ready at 8 o'clock in the morning.
Yes.
So and depending how many days a week you go,
Yeah.
I mean, it would be great if they had enough people to cover that, but I did it part-time. So if somebody wants to make a living at this job, they have to go all day. And it's very hard. And the same with putting people to bed at night. Nobody wants to go to bed at 7:30. So it's very difficult, and I don't know how many people you have now, if there's a waiting list, but I understand what the people want, but I also know it's a very hard profession if somebody has to make a living doing that.
Yeah, thank you for that. It's good insight to hear from both sides, right? Because you worked in that profession, and yeah.
PSWs don't make what they should make. They're worth their weight in gold.
Yes.
Oh.
I actually have two. You said you get checked for eligibility. Can you say some of the main criteria, like with age or mental ability, and do you have to have a doctor's proof of that? Because maybe you can call about what's available, but do you have to have some kind of official, yes, you are eligible? And also, family support. In my family, there's 8 kids. And so when my mom needed more help, it was like, well, you've got 8 of you, and we're all moms working, whatever. So we could scramble together coverage and things like that, but it was at, it cost personal time, all of that. I'm happy to do it, but
Yeah.
still a lot. So can you address any of that?
So you're talking about eligibility for Ontario Health at Home specifically?
Yes.
So that's determined by the intake care coordinator. So they gather information about how you're doing, and no, you don't need doctor's confirmation of any medical. It's not about age, it's not about diagnosis. It's more about how are you managing at home, what are you struggling with, what could we potentially support with.
Okay.
And then sometimes it's a care coordinator going out to do a home assessment. And sometimes that's the first contact, and then they determine eligibility for the other in-home services like Lisa and myself, PSW, that sort of thing. And they determine if you are eligible for PSW, this is what it looks like. You're eligible for this amount and that sort of thing. So yeah, eligibility is, we can tell we're not care coordinators, so it's all done through initially the call to the office or the referral to the office. And then oftentimes then it's a home visit, just to review specifically for that person or that family what the needs are.
What would be a time gap between that and getting actual care?
Yeah, so, to be honest, there are wait lists for services, and for a care coordinator to do an assessment, that happens fairly quickly, I would say. The first point of contact, the intake assessments happen fairly quickly. Getting someone out to the home fairly quickly. Some of the professional services, there's a bit of a wait list for. It's based on priority too, though, so the more urgent needs kind of rise to the top, and because that's what we're here for. We're here to help people. We don't want people waiting so long that they don't need us anymore. You know, that's the last thing we get to your home. Oh, well, I could have used you a while ago. So that's why they kind of prioritize, so we can get out to see the people in a hopefully prompt, timely manner. So.
And then is having a big family a detriment or whatever, because they sort of assume you've got it covered, but
Yeah,
it's.
again, the care coordinators do the assessment, so if you have a caregiver in home who is physically able, that's different than external, you know, like you said, children that work and all that kind of stuff. So I think the part of the assessment is, what is your support network? What does that look like? I mean, sometimes children are already helping with shopping and transportation and all that kind of stuff. But the personal care is a little bit different, right? So that's all part of the assessment. That's all included in what they ask. So.
Thank you.
Mhm.
Yeah, so you're called Ontario Health at Home?
As of today, that's what we're called. Yes.
Or, just so I can get it in my head,
Mhm.
it used to be CCAC and all the other names,
Mhm.
but now you're called Ontario Health at Home.
Mhm.
Ontario Health at Home. And you don't have to go through a physician or someone else to have someone come and talk to you, or that you can talk to and see about an assessment or something.
No, so the page that we have over on the table has on the back, getting in touch with us, there's a number and anyone can call. You, your spouse, your child, your neighbor, your whoever. Now we need consent from the client. Your neighbor could call, but I can't speak to the neighbor, but the neighbor can call and say, I'm concerned about Mrs. Smith down the road, and then we can then call Mrs. Smith and see if she's interested in the services and go from there. But yeah, anyone can call. I think people think the doctor has to refer you, or the doctor has to agree that you need help, and we hear from clients they haven't seen their doctor in years, or they can't get an appointment with their doctor. Their doctor doesn't know what's going on, so anyone can reach out to us.
So it could be, I understand if I called and said my neighbor needs some help, you can't just step in and do it, but like, let's say it was, a daughter that wanted, or a son that wanted to help their parent. Do they still have to have permission from the client?
So our client is the individual who needs care, and if they're able to give us consent, that's who we need to go with. We have clients that are not able to give us consent, so they've designated, they either have a power of attorney or a substitute decision maker. So we have clients that say, yes, I'm Mrs. Smith, but please talk to my son or my daughter. Because they want that person to be the designate and to help support them in arranging what they need.
That has to be a medical power of attorney. That's not just regular power of attorney.
Yeah, so if there's not a power of attorney, there's a whole substitute decision maker hierarchy that we can go through, but we do encourage people to have your affairs in order, right? To have POA for care decisions and for finances, and because then you never know when something could happen. You're going to need to pull in that support. So we can support people if they don't have that. If they haven't designated a POA, then there's, you know, documents we can guide people in the right direction to get those
This is
kind of
a
things.
new name now.
It's since
July of last year.
yeah.
I think atHome is together. It's not a spelling.
Yes. Yes.
Ontario
It's
Health.
atHome.
We don't say that. Yeah.
Yeah.
The buns are out.
Oh yeah.
The buns are out.
But we'll stick around. No, we can stick around for a few minutes if there's any other questions, but we really appreciate you inviting us here today. Lisa and I don't get out to a lot of activities like this, and so when our manager approached us and said, would you like to? We said, yes, we would. This is very different for us, so we really enjoyed being here with all of you today. Thank you so much.
Let's give them a hand.